Tumors of the uterus are, amongst others, myoma, rarely hemangioma, or sometimes malignant tumors such as cancer of the cervix or the corpus. Hypoechoic areas within the uterus are an indication of liquid or blood. Hyperechoic areas indicate some tissue, for example endometriosis. Very hyperechoic reflexes in the form of a flat line with reverberations are indicative of a coil. Especially in the case of pains in the lower abdomen and the existence of a coil, an ultrasound examination is indicated. The origin of liquid in the uterus could be mucus, any liquid, blood or pus. And in any case, a tumor which may be blocking the drainage must be excluded. The most common tumor of the uterus are myoma, or so-called fibroids. They are located in the muscle of the uterus, so in the myometrium, or they can be subserosal or submucosal. They are round-shaped. Sometimes they show an inhomogeneous texture, and calcifications can occur. Clinical symptoms are bleeding and maybe an increase of the abdominal girth. When there is a rapid growth, it can be an indication for a leiomyosarcoma. The sonographic findings of the myoma we can see over here. There is an enlarged uterus with multiple round-shaped tumors. Some of them are hypoechoic and some of them are more intense, so hyperechoic. And there is an inhomogeneous texture in this one and in this one. So in this case, it can be myoma, but we have to make a repeated examination to check for the size of the tumors. When the tumors are increasing rapidly by the next examination, there also can be a malignancy. In the second plane, we see again round-shaped tumors with inhomogeneous texture. Some areas are hypoechoic, some are hyperechoic. Again, what are the signs of a malignancy? A rapid growth and very enlarged uterus, fluid in the cavity, maybe symptoms like hydronephrosis or enlarged lymph nodes. Sonographic findings of the ovaries. The ovaries are oval-shaped, up to 3 centimeters. We can detect a blood supply from the ovarian and the uterine artery. Sometimes we find cysts, follicular cysts up to 5 millimeters. If there is a dominant follicle, it can rise up to 2.5 centimeters and burst with the next menstruation circle. Performing transabdominal scans, we need quite good examination conditions for finding the ovaries. So in this case, we can see the ovary over here. We have got a great follicle, size up to 2.5 centimeters. In this area, we are quite near the uterus over here and the iliac vessels on the right side. In this particular case, we used a linear probe to get a better resolution in the near field, and we can easily detect this oval-shaped ovary over here with a up to 1.5 centimeter cyst in this area. And once again, you will detect iliac vessels on the lateral side of the picture and the ovary over here. In this case of a pregnant woman, we can nicely detect the ovary on the right side, also with some reflexes of color Doppler, indicating the blood supply from the ovarian artery. And we have also a glimpse on the fallopian tube over here. Once again, we see fallopian tube, the pregnant uterus, and the ovary on this side. In this video clip, we can nicely detect the artery reaching and supplying the ovary here. The most common and most important findings related to the ovaries are cysts. It is essential that these cysts be examined by the means of transvaginal sonography, and there are definitive schedules which describe the procedure that has to be done then. But I'm not going to describe this in detail here. An exact identification of a malignant tumor by means of transabdominal sonography is not possible in the case of cysts. However, there are some criteria which are indicative of a malignancy. Size more than 5 centimeters. Inhomogeneous cystic and solid parts. Vague forms. Large thick septa. Papillary solid tissue inside the cyst. And adhesions to the surrounding tissue. Also, free fluid in the abdomen would be a sign of malignancy. If cysts are detected, a differential gynecological diagnosis is absolutely essential. Let's take a closer look on an unclear cyst. We can see over here a cyst nearly 5 centimeters in diameter. There are septa. Some of them are quite thick. I can't see any solid tissue inside the cyst, but on the next screen we see there are also vascularization in the septa, which can also be a sign of malignancy. So this cyst is complex and further examinations have to be done. Sometimes it's even possible to detect the fallopian tube when the examination conditions are very fine. The fallopian tube is 7 to 12 centimeters long, but is not regularly seen, and no cavity should be seen unless there is a hydrosalpinx or an ectopic pregnancy or even a tumor. So we have to take care when we see any solid tissue or liquid inside the fallopian tube. We have to mention it could be hydrosalpinx, ectopic pregnancy, or even a tumor. We go on with some cases. This was a case of a 70-year-old woman in a routine abdominal scan. We can identify the uterus. There is a small part of the urinary bladder over here. And when I go on, we can see this hypoechoic area in the region of the cervix of the uterus, which is not of the same echogenicity than the corpus of the uterus. So it's necessary to take a closer look. And we can see here over 7 centimeters of this lesion, hypoechoic, and up to 4 centimeters in the second diameter. And the carcinoma of the cervix was diagnosed. So keep in mind to scan the whole organ every time you perform the scan, not to miss such a very important pathology. A 45-year-old patient is admitted to the hospital and she complains about pains in the right upper quadrant. So we perform an abdominal scan. You detect the liver and the quite empty gallbladder over here. The IVC in the far field, but no gallstones are seen, so we proceed scanning. So we detect the right kidney and we can see a dilated urinary tract over here. So the diagnosis of hydronephrosis is made and we proceed with the scan of the lower abdomen. You can see an enlarged and quite inhomogeneous uterus. We go on further scanning. We see hyperechoic areas and hypoechoic, and this can be some liquid in the cavity of the uterus. So you have to see the clip. And yes, indeed, over there is a small amount of liquid in this enlarged and inhomogeneous uterus. So we have to think about pus, blood, And is there anything which blocks the drainage of the uterus? And in the following scan, in the longitudinal scan, we see that the tissue in the region of the cervix is thickened and is also inhomogeneous. And in this case, it was an advanced stage cancer of a cervix carcinoma with hydronephrosis and free fluid in the abdomen and fluid in the cavity. In the next case, ovarian cancer was already known, but there was the report of an increased abdominal girth. So we scan the lower abdomen, and what we can see over here is a quite huge amount of free fluid in the lower abdomen. We see the ovary here with the ligamentum connecting the ovary to the uterus. In this case, it's easy to detect the ovary because it's inside a quite huge amount of ascites. And also in the upper quadrants of the abdomen, there is a lot of ascites. We see intestine in between all these huge amounts of anechoic liquid, indicating ascites in the whole abdomen. And when you take a closer look to the abdominal wall of the patient, we see that there is a solid tissue directly connected to the abdominal wall, so we can detect metastasis inside the peritoneum. In this area of the peritoneum, there are metastases of an ovarian cancer. When we scan the uterus in a transverse mode, we can easily detect the ovarian tissue on the right side and on the left side, and the uterus hanging in between the ovary, connected with the ligament to the iliac fossa of the left and right lower female pelvis. When we scan the uterus, we can easily detect the ovaries on the right and on the left side, and also the ligamenta connecting the uterus with the lower abdomen. The left ovary is quite greater than the right one, but it's not clearly seen whether the tumor arises from the left or the right side. Also, ascites in the right upper quadrant around the liver. And once again, metastasis in the peritoneum and at the abdominal wall of this female patient over here. So we get the diagnosis of ovarian cancer with a massive amount of ascites, peritoneal lesions, and a sonographic guided puncture of the ascites has to be done. It is very important to scan the female lower abdomen to identify pathologies of the uterus, the ovaries, and the fallopian tube. It's useful to scan the patient with a filled bladder to obtain the best image quality, and sometimes we can use the linear probe to get an even better image of these small structures. When cystic lesions are found in the ovaries, further investigations have to be done. It is possible that a malignancy is causing these cystic lesions.